Welcome, everybody. I know we're in the home stretch of the AFCA conference, and I'm probably standing between you all and going home. But I'm so glad that you're here, and I'm hoping for a really informal discussion today. I certainly have a little bit of a presentation to share with you, but mostly I want to talk and get your feedback and share some strategies. So my name is Scott Britton. I'm at Public Children's Services Association of Ohio, and we are the membership association of the county children's services agencies. And I'd just like to take a moment to kind of walk around the room and have you introduce yourselves and let me know whether you are a kinship caregiver, a primary parent, a foster caregiver, an adoptive parent. We'll start right here.
My name is Loretta McGowan. I'm from Cleveland, Ohio, and I am a therapist, and I have my own practice.
Oh.
And I work with families, and I specialize in trauma and grief.
Okay, wonderful, great. You all ready to introduce yourselves, or you need a sec?
I can say
You good?
My name is Tamara Lucy Thompson. I've been with Buckeye Ranch for 14 years. I'm a foster parent.
Very good.
Yes.
My name is Casca Thompson, her husband. I've been with Buckeye Ranch 8 years.
Welcome. All right, my lunch partner.
I am Elizabeth Hufford, and I am a foster parent for the Village Network. I have been fostering for this is my 9th year.
My name is Bertha Hicks. I'm a foster parent for the Village Network. Foster parent for 14
I'm Alicia Preston. I'm a foster parent for the Village Network. I've been a foster parent for 23 years. I am on recess right now.
Okay.
Taking a break.
I'm Sandra Botniks, and I'm with the Village Network, and I've been a foster parent for approximately 20 years.
Wow, very good. Can you introduce yourself? Yeah.
I'm Chris. I'm the camera guy. I'm Ella's boyfriend. We've been together for 6 years.
Wonderful. Glad you're here. Ella is awesome, right? All right, we have another camera person in the back.
Yeah, hi, I'm Paige. I'm also the camera person, but for a different place.
So you thought you were staying behind the camera, right?
I'm not supposed to talk.
All right, we'll let you up.
Phyllis Ledford. I'm from Village Network. Been foster parent for about over 13 years.
Wonderful.
I'm Janet Webb. I'm with the Village. I've been a foster parent for 34 years. My specialty is PSB, and I'm also an adoptive parent a long time ago.
Great. I'm an adoptive parent myself.
I'm sorry, my ring camera, somebody's at my house.
Oh, okay.
sorry.
No worries.
Hey.
Okay. I'm Veronica Mayer. I am a primary parent representative on the AFCA leadership team. I am also a MRT, which is multidisciplinary representation team, parent advocate with the new pilot in Summit County. And I serve as a parent advocate for parents who have an open case with Children's Services. And I work closely with an attorney and with a social worker to provide resources to the parent and walk them through the process.
Wonderful. I've heard your name. It's nice to meet you.
Oh,
Thanks for all the good work you're doing. How about you two? Oh, behind you. You wanna introduce yourselves?
Oh, yeah. I would like to know your name, ma'am.
My name is.
Her name is Jay Renee.
Hey, Jay Renee.
And she is 5 years old, and she'll be attending kindergarten shortly. She is a professional, very special singer. She's very talented.
Awesome.
Very loving, caring, full of energy.
Perfect.
And she is soaking in all of the
I'm sure there won't be a test. Don't worry.
Good. Okay, and then we have this lovely young lady who's enjoying her pretzel. This is Song. She is my oldest. She is very mature for her age. She had a lot of great questions for a lot of the topics that we covered
Good.
regarding multicultural differences and how foster care works. And she's really for me being a foster parent now.
Great.
Yeah, she's my inspiration.
Fantastic. Welcome to all of you. Glad you could bring the family. Go ahead.
Richard and Teresa Johnson, respite for Village Network.
Very good. We need more respite care providers.
Teresa and Jeffrey Jones were foster parents with the Buckeye Ranch 15 years.
Okay.
I love them.
Lions over here.
Well, welcome to all of you. I'll just start out with a little bit about PCSAO. We are, as I said, a membership association. That means we do public policy and communications and training and leadership support for our member agencies, and the decisions we make are driven by our member agencies, similar to the way AFCA is driven by its members. And but oftentimes our goals align closely with AFCA's, not always, but many times they do, and we're glad to work with them. However, I recognize that there is sometimes some tension between the public children's services agencies and the foster caregivers, between parents of origin and other folks in the room. And I'm here so we can talk about some of that and talk about how we move forward with that. Our mission is safe children, stable families, and supportive communities. We know that if all those things are true, then we get to where we all want to be. And we are do a lot of work at the State House on public policy, trying to promote bills that advance the work that we all do, and trying to stop some of that knee-jerk legislation that we see out there that could actually harm children and families. And just like many organizations, we have a strategic plan. I'm not going to talk about all of it, don't worry. We do those things in the inner circle, the blue items, just like every other association does. We provide benefits to our members and we lobby at the State House. We try to elevate the work that they do in the public's perception, and we lead on different program excellence models. Anybody here heard of Ohio Start? That program is managed out of PCSAO. So that's one example of how we strive for program excellence. But in 2020, leading up to 2021, our members added all of those things on the outside, the orange parts of the wheel. And we are going to talk about those a little bit later as solutions to some of the challenges that we're experiencing right now in children's services. So let me just kind of talk about two of those challenges today, just to kind of paint a picture of the struggles of county children's services agencies. You may be aware of it. We have a tremendous workforce challenge right now. It existed before the pandemic. It existed before everybody started resigning from their jobs, but it has certainly been exacerbated by the pandemic. And so we know that we are seeing a lot of turnover in our key caseworker positions, and we know that every time a worker leaves, that means that the workers who remain behind, their caseloads go up, their stress levels go up, but even more importantly, we know that every time a caseworker turns over, a child lingers in foster care. They spend longer in foster care, not getting reunified with their family, adding additional trauma to their lives. So we need to address this children's services workforce for a number of reasons. We've been tracking turnover for years, and we know, for example, back in 2015, 2016, we were seeing 1 in 7 of our caseworkers leave with no concerns by their supervisors. They were great caseworkers, but they were getting burnt out. They were leaving the field. Overall, in those years, we saw about 1 in 4 children's services caseworkers turnover. Some of those, and I'll send the PowerPoint out afterwards, so you don't have to take notes or take pictures, although you're welcome to do so. But apparently this is being recorded, although I don't want that to dampen anybody's enthusiasm for talking and sharing. But we saw almost 1 in 4 caseworkers turnover. Some of that was what we call positive turnover though, right? They were getting promoted or they were retiring, which is something we can't really control. They were moving laterally within the organization. And some of it was that they were just bad caseworkers and they were being fired. So that's a positive too, right? But 1 in 7 had no performance concerns by their supervisors. So that was a concern. Then in the year before the pandemic, that turnover jumped to 18%. That means caseworkers who were doing a great job were just leaving. They were going to be managers at Target. They were being scooped up by Medicaid managed care companies. They were going to 9-to-5 jobs in offices where they worked with people over the phone instead of face-to-face, and they didn't have to go out at 2 in the morning to knocking on doors. So we were seeing more workers leave. During that time, however, we were seeing in the first part of the pandemic, when there was a lot of uncertainty, that negative turnover kind of reduced back down to 14%. But overall, we were seeing turnover jump quite a bit, 45% overall turnover, 38%. So we knew that a decade of an addiction epidemic, the pandemic where they were continuing to go out and knocking on doors when a lot of other people were working from home, was taking its toll on our caseworkers. And in fact, we know from a study by a national group of academics that's actually still working on introducing some interventions to improve recruitment and retention of workers, that more than half of our caseworkers experience post-traumatic stress levels that reach the threshold of PTSD. So what they're seeing in the field, what they are experiencing, all of the stress that they're carrying has really serious outcomes for them, and we know we need to do something to address that. So what is being done at the state level? And again, we're a nonprofit organization, we're a membership association, we're not the State Department of Job and Family Services, but we advocate with this Department of Job and Family Services to say our county agencies are struggling, they need support. And so some of the things that have been introduced include this Quality Improvement Center for Workforce Development, the QuickWD. They have been basically measuring outcomes, not just here in Ohio, but in about 7 or 8 other jurisdictions around the country. And two of the things that they're measuring here in Ohio are resiliency training, so to make caseworkers more resilient, so when they experience something really traumatic, they can bounce back from it. And also better coaching from their supervisors. So we're still waiting on the results of that study, but we're hoping that they're positive and that's something that we can scale up around the state. We know that when Governor DeWine took office that he basically launched a series of forums around the state on foster care. Anybody in here attend any of those forums? I attended about 3 of them. So a lot of foster caregivers attended those forums, not so many birth parents, unfortunately. But they basically led to his creating a Children's Services Transformation Advisory Council that has released 37 recommendations for improving the children's services system. Many of those are in the workforce area. There's been a rapid response team created at the state level. There's some interesting technology around virtual reality headsets. Anybody ever worn one of those for gaming or anything like that? So if you haven't seen them, there's a virtual reality headset that makes you feel like you're in the home. And so a caseworker can practice asking questions, looking around, seeing things in the home, getting responses. It's very realistic, and also some online onboarding for new caseworkers. Lots of training and surveys. We're trying to beef up our university partnership program. So at 8 institutions around the state, college students can take the core training to become a caseworker. So when they graduate, they can hit the ground running. We're introducing that now. We're introducing 4 new universities to that program in the next year. And we've been doing a lot of workforce research and data collection. And in fact, PCSAO engaged the Ohio State University College of Social Work in doing some research. I'm not going to go over all of that now. I just wanted you to know there are some efforts happening out there to try to address the extreme workforce shortages that we're seeing in children's services they're going to take some time to bear fruit. And so our system is still very much struggling under the weight of all of these vacancies that we're seeing out there. So if you know somebody who's looking for a career and they're the right fit for children's services, encourage them to go into that.
It's hard to convert somebody to volunteer to get the PSD.
The PTSD, right. You're basically sending them into the lion's den, right? Yeah. Well, I'm going to talk about some of that as well, about some of the other things that we're doing to try to address that. The other challenge I wanted to present is our placement crisis right now in children's services. I don't love this picture of kids sleeping on the floor, but in the lobby, but it's a dramatic depiction of some of the things that are happening around the state right now. We simply don't have enough foster homes for the children coming into care. I think we have, let me see, we've got, as of February, we've got 76, almost 7,700 licensed foster homes in the state of Ohio. A little more than half of those are private agency foster homes. A little less than half of those are public agency foster homes. On any given day in Ohio, we have more than 15,000 children in custody. And so we don't have enough homes for those children. We don't have enough homes willing to take older children who have more challenging behaviors. And I know many of you with Buckeye Ranch and Village Network are what we call treatment foster homes. We're so glad that you're here. We need more of you. We need more of you who are willing to take children with acute behaviors, to work with their parents toward reunification, to make sure that they have the services wrapped around them that they need to heal. So that's one of the challenges we have. We know that children don't have good outcomes over the long term if they're in residential treatment. We don't want to put children in congregate care, but that's happening more often now, I think, because we don't have enough foster homes for them. And we just know that when you are living and growing up in institutions, you learn how to function in institutions as an adult, right? Whereas if you're living and growing up in families, you learn how to function in families as an adult. We want children growing up in families. So we know that this issue is not new. I think I skipped a slide here. There we go. We have actually been studying this since 2016. We issued what we call a Children's Continuum of Care Reform Plan in 2018 that basically has kind of 4 parts. The first part says we need more services in Ohio that prevent children from coming into foster care in the first place. There are children in foster care who wouldn't need to be there if we had supports to wrap around that family. At the same time, on the back end, we need those same supports in those families when the children go home so that they don't re-enter foster care down the line. And then if they do come into foster care, we need to modernize our foster care system, and we need to make sure that if they do have to go into a residential placement, that is of short duration and it's high quality so that they're getting the treatment that they need and stepping back down into a family setting. So that's the essence of our Children's Continuum of Care Reform Plan. We were really gratified that the Ohio Family Care Association endorsed that plan back in 2018, and we're slowly starting to see pieces of it come together. We knew it was going to be a long haul, right? We don't fix that kind of a system overnight, but we think we put some good recommendations into place, and we're starting to see some of those come to fruition. However, during 2021, we were hearing from our member agencies that the placement crisis was really getting worse, that they had more children who were sleeping in lobbies, as the picture showed. They couldn't find placements for some of these children with extremely acute behavioral challenges. And so we did a survey, just 19 PCSAs. It was Christmas time. We knew we wouldn't get a good response. We limited it to our board, which is fairly representative of the state. So take these results as a subset, but probably pretty much able to generalize to all of Ohio. We asked 3 things. Who were the kids coming into care, not primarily because of abuse or neglect, but primarily because of their behavioral health, or primarily because of their developmental or intellectual disabilities, or primarily because of a diversion from juvenile corrections. So let's take each one of those. behavioral health. We've had an issue in Ohio for many years where some parents who have had to make a traumatic and terrible decision to surrender custody to a children's services agency because their insurance couldn't cover the mental health treatment that their child needed. And so they basically surrendered custody, relinquished custody, and those kids were coming from homes where there was no abuse or neglect. Those parents simply couldn't afford the treatment that the child needed. And so slowly we're putting some solutions in place to try to prevent that. But we know that, the mental health crisis amongst our children existed long before the pandemic, right? I think the pandemic kind of shone a light on it, but it was there beforehand. And we know that our children are needing more and more mental health services, and we're seeing that come into children's services. Developmental and intellectual disabilities, a lot of our local DD boards don't begin serving people until they're 21 years of age. And so again, when parents can't manage the behaviors of a child with autism as they get older and get bigger, sometimes those kids come into children's services custody. And then in terms of juvenile corrections, we've been really pleased to see some of the reforms happening in juvenile corrections. I mean, 10 years ago, there were more than 2,000 Ohio children incarcerated in the state in a juvenile facility. Now we have less than 500, so we've seen that movement. We don't believe children should be incarcerated, but at the same time, where have some of those children gone? They've gone into children's services custody. So oftentimes, because Ohio gives more discretion to judges than many other states to basically place those juvenile offenders in children's services custody, we're seeing a lot of those kids come in. And our foster homes simply aren't often trained and willing to take children with that kind of history. So we asked about those 3 behaviors in the survey. We also know that there's a lot of crossover, right? Sometimes children with significant behavioral health also have developmental disabilities. Sometimes the kids with DD end up offending and end up in the juvenile corrections system. So there's definitely crossover in that. But what we learned is that in 2021, nearly 1 in 4 kids came into our system, which is designed for kids who have been abused or neglected, not primarily for those reasons, but primarily because of their behavioral health, their developmental disabilities, or their juvenile justice issues. And our system has been overwhelmed. We don't know how to work with those children. We often struggle to reunify those children with their families. And because our foster homes aren't necessarily trained and available or able to take those children in, we end up placing them in institutions anyway. And the costs are tremendous, and those kids aren't getting good outcomes. They're going into institutions that are probably very similar to the juvenile corrections institutions.
Why would there ever be a thought to say, in order for a kid that got a behavioral problem, we're going to take them and give them funding? Why wouldn't you give the parent funding?
Yeah, we don't give people money in this country very often, do we?
I'm going to take your problem and pay for the...
Yeah. No, I agree. We need to change our philosophy.
The world would do that.
Yeah.
I said, no, you keep your kid. I'm going to give you some money to take care of your kid.
Yeah. We need community supports for these families so that those children can remain at home or get their needs met in the community and not have to go into the foster care system. So just looking a little closer at the juvenile justice results, we found about 1 in 4 of those kids who had been diverted had been accused or convicted of a violent felony. So again, foster parents look at a child with a record like that and they say, no thanks. We end up placing them in an institution. And as you can see, many of those kids come in with no abuse or neglect. They may have had it in their families at some point. We know there's probably dysfunction in the family, but that was not the main reason why they're coming into children's services. A judge basically says, I'm being incentivized not to put you in prison. I'm going to put you in children's services custody instead. So the number one reason why agencies say this is happening is because there simply aren't enough community-based alternatives. We don't have good community-based mental health services. We don't have community-based services for respite, for example, for a family with a child with autism so that they can get a break. We don't have community alternatives for youth who have been accused or convicted of serious felonies. Yeah.
One of the biggest things that just boggles my mind, I don't know, maybe it's just me because I see as a therapist. For our physical health, we have preventive care.
Mm-hmm.
Our mental health is the same way. You need preventative care.
Right.
Everybody thinks of mental health along the lines, including the policymakers, as a mental health disorder. No. It has to do with learning how to cope with life on life's terms.
Yeah.
When we are in elementary, we get math, reading, science. We don't get coping skills.
Mm-hmm.
Why not?
Right.
They try to implement it now.
I know.
Emotional learning.
They are.
It's some of
We're
the.
slow to the game, but we're getting there, right?
They
Right. It's just happening too slow.
Yeah.
Because
Speed it
the things that were implemented early on before mental health, they took away, and this is how we operate in this country. We take away before we implement something else. So they took away prayer and morals and things like that, which kept people on a, kept us from doing anything stupid, because we knew, if I kill somebody, oh my gosh, God is going, not like me anymore, So it kept us having some type of moral center. They took all of that away and didn't implement anything else. So we have a bunch of angry children.
Defense and education, it starts at home.
It
Now they
does.
keep taking this responsibility
No,
and accountability
no.
on the parent.
It starts
Instead,
at
you know what I mean? I
home.
always hear like, the schools ain't doing this, the schools ain't doing this.
But you have
But-
to have a community around that.
Yeah.
Because one or two parents cannot raise a child.
Mhm.
It takes all of us.
Yeah.
Like, me personally, I consider every child belongs to me. I don't care white, black, purple, or blue. If I see your child doing something good, I'm gonna support your child. If I see your child doing something wrong, I'm that crazy one who will say something. I ain't nothing happened to me yet. I'm 50. And I've been doing this all my life.
Well, and I like what you said about mental health. I mean, parents don't relinquish their children if they get cancer, right?
Exactly.
They relinquish their children, though, often, sometimes, if they have a mental illness.
Because we haven't been taught how not to.
Well, and the payment
I mean,
structures and the supports aren't in
right, the
place to
supports are
make
not
that
there.
possible.
Now, and that's another thing. We used to have more wraparound services, and then they took those services
Right.
away. They took the pot of money away
Mm-hmm.
and gave it to the big conglomerates and told the big conglomerates to trickle it down to the smaller companies, which they did not do.
Yeah.
Which we knew from the beginning they wasn't going to do. So,
We've got a lot of work to do with the
It's a lot of
system,
work.
right?
It's a lot of
Absolutely, and that's why I wanted to kind of bring this to your attention, because obviously this is exacerbating our workforce issue. Our caseworkers are spending hours, days, calling dozens of foster placements, residential treatment facilities, trying to find a placement for these kids, because too many of them just say, no, we can't take them, and too often we're left with that option of a child staying in the agency. Now, they're not usually sleeping on the agency floor or on the lobby floor. Oftentimes our agencies are even putting in bedrooms and bathrooms, but that's still not good for the child, right? The child should be in a home, the child should be in a place where they're being supervised by trained caregivers, not by children's services staff who are doing 24/7 work above and beyond what they had to do. So we've got a placement crisis in this state, And we know that long-term, we've got some new supports coming. I think many of you have probably heard of Ohio Rise, the new Medicaid managed care program for children and adolescents with severe behavioral health challenges. We know that's coming. Our directors are hopeful about it, but they know it's going to take a long time to get started and to get up to speed. And I don't want to go through all of Ohio Rise unless you all have some questions about it. There's a lot of details in there. It's basically Ohio has not been able to use Medicaid to pay for services that other states have had for decades. And we're finally getting to the point now where Medicaid can pay for some of these services like mobile response or intensive home-based treatment services, psychiatric residential treatment facilities that we've never been able to pay for through Medicaid. And so now we're going to have these services available.
Do you know if they're offering respite?
Yes, respite is also something that is being paid. We're hoping there's not too many strings attached to it, but it's another service that has recently been has recently gotten some attention. But we've got a ways to go. So more about Ohio Rise. I won't bore you with the details. Basically, after we released this survey, we issued a call to action. Our agencies aren't saying that we shouldn't serve these children. We believe that these children are our children, but we believe that there are other systems, the DD system, the court system, the mental health system, that need to come together to help us serve these children so that we're getting better outcomes for them. Because these children are not coming in primarily because of abuse or neglect, which is our system's responsibility. They're coming in because the other systems failed them, and Children's Services is their last stop. Yeah.
Okay, I did hear you mention that you gave credit to the juvenile justice system, I guess, with the numbers, because they have less numbers. But what else would you speak on as far as how they've been assistance to these kids, other than reducing the numbers?
Well, I'm being recorded, so I have to be careful with what I'm saying. You know, there's been there was a good program put into place called Reclaim that financially incentivized courts not to incarcerate children. Great idea, right? The idea then was that they would invest those dollars in community-based alternatives.
That was spoken.
That was the idea.
Okay.
Yeah.
What is an example of that?
Well, let's just say that it would be a day program for those kids where they could come and have positive mentors and supervision. They would have exercise and learning opportunities and all of those kinds of things that they need to become productive and to change their behaviors. And you know, that idea of keeping the community safe from the children versus keeping the children safe from the community. But those Reclaim dollars weren't invested in programs like that.
So I can speak for Direction for Youth. I know that they're a big resource.
Good.
But I didn't know if you knew of something personally that you've seen that came out of it, because it's not the system that we used to as of coming up. You know what I mean? Like having a parole officer used to be a threat. Now it's like that's your buddy.
We were talking about that at lunch.
So just the whole revamping of the whole program gave it a different taste of what juvenile justice systems really their responsibility.
Yeah,
or their
a
role.
little less tough love and a little too much love, huh?
Yeah, you want to call that love? 'Cause yeah, it's like again, it doesn't seem like they're as invested. Like I'm coming to check to see if this child's home, and then I'm going home. Like I don't know what is your responsibility?
I heard that conversation at lunch. That's interesting.
When we talk about programs, I like programs, but I'm always scared of programs because whenever you got programs, it's always a way to cheat the system.
Well, and programs and services, right. I think you're exactly right. And programs and services aren't where families heal, right? Families heal together. So, I mean, another example of an evidence-based program for kids with juvenile justice involvement is called MST, the multi-systemic therapy, where they actually bring people into the home and begin that process of healing so that the parents and the child are understanding the boundaries a little bit better and their responsibilities and preventing future recidivism.
Do we have any states that already have these and you seeing positive impacts from them?
Yeah, and in fact, that's one of the things that Ohio Rise is bringing in. Multisystemic therapy will now be Medicaid billable, which it wasn't before. It had to be paid for out of a private insurance. So that is a new thing where we know it works, it's been tested and evaluated, it's been shown that kids coming out of that program do a lot better, and now we have it in Ohio. It's only in certain places right now. It's going to take a while to build it out so that, a kid in Benton County has the same access to it as a kid in Franklin County, but it's getting there. So again, we think that these children are all of our children. We want to work together with other systems. We want to improve the placement options that we have. We're working to build out a different kind of treatment foster care program, so we've got more parents trained to work with those kids so we don't have to place them in residential treatment. And when they do have to go into residential treatment, we want to make sure that that's of high quality and of short duration. So we issued that call to action, and we're starting to see a little bit of movement on the state to try to address that. So with those two kind of overarching problems that we're experiencing, I just wanted to pivot a little bit to some of the solutions that we think we need in Ohio to really build a better, more family-centered children's services system. And those are that kind of outer wheel of the strategic plan that I mentioned earlier. And that's on our website if you want to read it in detail. I'll share just a little bit about those 4 issues. One of them, of course, is that continuum of care that I talked about earlier, that plan that OFCA endorsed. We really believe that we're starting to see pieces of that, like Ohio Rise, like treatment foster care reform, come out of that. And we believe that if we can continue to kind of build in more of those supports, we'll see fewer kids coming into foster care. We will drive down costs to taxpayers, and most importantly, we can strengthen families. The next area is around race and equity. I don't think I need to tell you that there is a history of racism in the children's services system. There's a perception of it now, similar to the perception of law enforcement, that we're a family surveillance program that's more interested in ripping families apart. And we've got a lot of work to do in that area. PCSAO had a kind of a year-long training series last year to try to level set with member agencies and their staff around issues of race and equity. All of those recorded webinars are on our website, on our REI page, if you want to check them out. There is a particularly good webinar about the history of racism within the children's services system. I mean, effectively, we have set it up to operate the way it is, and that's what we have to change. So I think that was a really important first step. The next step this year is that we brought agencies together in a community of practice. They're identifying a policy or practice that they want to change that they hope will improve outcomes for Black and brown families. Because, I mean, we know we've got a disproportionate number of African American kids in our system and other mixed race kids. It starts at the referral point with mandated reporters and with community referrals, and it continues throughout that. And we have disproportionate representation. And we don't get good outcomes for our Black and brown children in the system. So those kinds of things need to change, and we hope we're taking some good first steps to address that. Then the third item is around safety culture, and that is probably a term I know I wasn't familiar with when I first heard it a couple of years ago. It really borrows from the literature on safety science. So if you think about airliners or nuclear facilities or hospitals, high risk industries where if things go bad, a lot of people can die. And there's been a lot of work over the last decade, I would say, in terms of safety science, looking at disasters in those industries, not as pointing your finger at one person and saying they didn't do their job, but looking at the system and trying to improve the system so that those things don't happen. So in our field, the equation there is really around child fatalities and near fatalities, and so not saying this caseworker didn't make a visit or something like that, although, it's important to look at what the issue was, but looking at it as a systemic issue, and how do we improve the system so that those kinds of things don't happen again. Then, along with the safety science aspect, we've kind of married to it a general safety culture idea. Our caseworkers are in a job where you can't mess up. And they're always walking on eggshells around whether they have dotted the I's and crossed the T's. And so how do we create a learning culture within our agencies so that caseworkers feel comfortable saying, I need help, I don't know the answer to that, where directors are vulnerable and comfortable talking about when they've made wrong decisions, and that the whole organization is focused constantly on improvement. That takes a long time, right? We'd all like to work for an organization that's like that, I think. And that takes a long time to develop that kind of a culture in the agency. And then finally, it's about making sure that our caseworkers are psychologically safe in terms of being in an organization where the stakes are so high, but also physically safe in terms of some of the threats to their safety that we've seen. So all of that kind of comes under that umbrella of safety culture. And this year we've got the first cohort of counties that are going through that, having their staff take surveys about what's really going on in the agency and how they feel about it. It's great feedback for the agency leadership to begin making changes. And we're kind of excited to be building this kind of roadmap to improving our organizations. But it's all, it's a constant process, right? An iterative process, as they say, because every time a director changes, every time a manager changes, you got to make sure that that culture is preserved and make sure that it remains positive. And then last but not least on our orange wheel, we've got a shared practice model. And this is kind of where I wanted to spend most of the time of our workshop together, is really around this idea. Does anybody here know what Ohio's Children's Services practice model is? We don't have one. We don't have one. So some of you have heard of CAPMAS, maybe. It's our model with all of the safety assessments and family assessments and risk assessments. It's kind of the nuts and bolts of what caseworkers do throughout the life of a case. Some people think of that as our practice model. We have differential response, which is how cases are assigned to either a traditional response track or an alternative response track. Some people think of that as our practice model. Really, there's no agreement on what the heck our practice model is in Ohio. And if we don't know what our practice model is, how can we ensure some consistency across 88 counties, because we're a state-supervised, county-administered state? How can we make sure that not just that caseworkers are doing what they're supposed to do, because practice model isn't really about what you do. What you do is all the rules you have to follow, right? It's the boxes you have to check and the forms you have to fill out. Practice model is about how you do it. How do you engage with families when you're out in the home? And that is the shift that we want to start making in our field and kind of identify that how. What are the behaviors of a really good caseworker that lead to better outcomes for children and families? We certainly have a great training program that teaches on what you do and all of the different considerations of it. But in terms of, do we have agreement on how we do that as a system? So I'm going to show you a draft of some practice model statements, and I'd love to have your feedback on these. Now, I will say in all transparency that we had our first big design meeting on Wednesday of this past week, and so all of these are in flux. This was a draft then, and we spent the whole day chewing them up, swallowing them, thinking about them, spitting them back out. So these are going to change. And again, these are aspirational. This is not what our system is now. This is a possibility of where our system could go. Not in terms of what we do, but in terms of how we do it. So I'd love to hear your response to how you think our system would change if we believed that families were experts on themselves. How would it change if we believed that honesty builds trust and includes telling the truth, sharing concerns, clarifying roles, being transparent about decision making? How would our system be different if we believed that to respect and value families, we must listen and incorporate their culture, beliefs, and community into all the services provided? How would our system be different if we believed that people can change? How would it be different if we believed that supporting families means honoring their experiences by consistently treating them with dignity and compassion? How would our system be different if we believed in diligently connecting families with effective, child-centered, family-focused, strengths-based services and supports? How would it be different if we believed that safety is physical, emotional, and relational, and can be achieved for a child only in the context of loving and lifelong family and community? And how would our system be different if we believed that family is defined by the families? So, even though we've got a whole different group working on this, and that group includes caseworkers and supervisors, it includes primary parents, foster parents, kinship caregivers, a former foster youth, as well as some academics who specialize in implementation science. We're kind of testing these out with different groups, and that's the main reason I came here today, just to kind of have a conversation about, what do you think about this? Is this where we should be going as a system? Should we be going in a different direction? Are there different values, different behaviors that we should embrace?
I got a question.
Yeah.
Why did it take so long to come to the conclusion that we never even had?
Yeah. Look at that webinar on the history of children's services. I mean, we have been so laser focused on safety as a system that we forgot about well-being, we forgot about permanency, we forgot about the importance of keeping families integrated. We just said, keep the child safe above all else. And that's not always going to get the best outcomes.
So I guess my next question is now that we figure out there's a new thing, is this the only new thing that we need to be looking at, or did we miss something else? Coincide with this? No, but this is huge. They never looked at the way. They always just looked at a safety group.
Mm-hmm.
Never looked at what's the, yeah. So
I think that
we missed.
I think that shared practice model, safety culture, and a focus on race and equity are 3 good places to really start with transforming our system.
So let's go.
Those are kind of the internal ways to transform it. Safety culture,
Okay.
race and equity, and the shared practice model. That's the way we transform ourselves internally. And we think that our continuum of care reform plan is the way our system transforms as a system externally. We don't have all the answers. We'd love to hear your thoughts, but what do you think of these?
I think they're excellent starting points there. You hit the nuts and bolts, pretty much everything that I can think
Good.
of, at least in this moment.
Okay.
But I think that we should, I think that we really need to implement something where we really zone in on parents.
Mm-hmm.
Like on the parents, like our focus is, if we had a safe environment where kids were safe at home, we wouldn't be having to think a lot about extra families or extra care. So if a lot of our stuff pointed to helping, like our main focus is going to be the kids are going to be at home.
Yeah.
So let's really harness in on making sure the parents at home get everything that they need.
Yeah, no, I mean, we've been in a country where for the past 40 years we've been stripping away that safety net, right? So I agree. U.S. economic and social policy probably is a more effective place to start, but right now I don't see that as.
We keep going around it.
Yeah.
So if we keep going around it, then we know we gotta keep these other systems strong, because our focus is not on where it really needs to be.
Yeah. No, I agree. You're preaching to the choir there.
I want to critique your statement.
Please.
So the first one, I think, because y'all use the word expert to me kind of gives that word profession, or like you know what you're doing. So obviously we're saying there's a problem in the family. So to take out that word expert, because they wouldn't see nothing wrong with it. If I'm an expert, then why are you saying that I need assistance or I need help?
We had that
So
same
that
conversation
contradicts-
Wednesday, just so you know.
Alright.
Yep.
Then it contradicts that we believe people can change because
Yeah,
you're thinking you're expert.
yeah.
I don't need to change.
Yep, the conversation we had was around the fact that they are experts on their own experiences,
Okay.
and that, yes, sometimes they need people coming in to point out the supports or the changes that they need to make, but to trust them to build trust that they're going to tell you about their own experiences. Too often our caseworkers are meeting these families on the worst day of their
But
lives,
then it's
right?
always that creative approach where you try to let them also understand where that system might not work. Just because mama did it, or that's the way you was raised, or
Yeah.
that's what you've been comfortable doing for the last 15
Yep.
years, or your first 3 children.
Yeah,
This, you know what I mean? Like, there's obviously something that needs to
Yep.
be implemented to change. So,
absolutely. What else you got?
we believe family is defined by family.
Mm-hmm.
I think that's, I accept it as, saying you can define what your family is, but is it healthy? Is it strengthening? Is it, is it gonna thrive? Like you said, this is your family, but she hurting over here and you looking, because we just family, I still think like that, it doesn't open it to, I don't know, what is your definition of family? Like, it
That's
can be
what it is.
critiqued,
What is
it
your
can be
definition of
changed, it
family?
can be manipulated, you know what I mean? I'm not just gonna set one person's definition.
I think one of the things that we have going for us in Ohio is that we recognize fictive kin as kin. You don't have to be blood related
That too.
in order to be considered family. So as we're looking for kinship placements or kinship supports for that family, we can look outside of the uncle and grandmother and so on to the neighbor and the teacher and the extended friends and stuff like that. So that's one piece of that I think it's trying to say. Yeah. Yes.
And it goes back to, it takes a village to raise a child.
Right.
Which, we had that, and then they went to the me. You didn't need all these other people. To go back to what was originally in place, is that your whole community is family. And so with that being said, you brought up something that made me notice. The trauma piece, dealing with the trauma, which I don't care what family you're dealing with, they're dealing with trauma, flat out. If they've been molested, if they've seen a shooting, all of it's trauma. So to deal with the trauma piece, I think is going to be important. And whoever's going into that home, to be able to meet the family where they are, which is missing, because, how can I put this delicately, on the race divide. First of all, if you don't look like me, I don't trust you. You're coming from a system that I don't trust.
Right.
You don't look like me, so I don't trust you. Which is a hard connection to make. And then, to add on top of that, most of the workers, I won't say most, I will say some, of the workers have never lived in a community that looks like me.
Yep.
So you don't have no vantage point to even begin to meet me where I am.
You're absolutely
They
right.
always use the word meet the family where they are, when most of them do not.
Yeah, our average caseworker, I would say, is a 22-year-old white middle-class female, fresh out of college, no kids, and we're asking that person to go into a family that's very different and try to figure out how to talk about safety and to consider safety in, an environment that they have no experience in necessarily. It's a huge burden that we're putting on those caseworkers, and an unfair position for the family when
That's on their lives.
the decision to remove or not, even though that's ultimately a court's decision, starts with the caseworker.
Absolutely.
Yeah.
And so if that person sees something that's outside of their purview from being normal,
Mm-hmm.
but it may be very normal for
Absolutely.
this family.
Yep.
And for that culture, we're like, oh.
That
you know,
child isn't safe.
This child shouldn't be in this
Mhm.
environment.
Yeah.
90% of these children, this is what their environment looks like.
Yep.
So, we have a long way to go. So many of our systems are just ingrained with that in it.
Yeah.
It's
It's going to take a while, right?
It's
But
gonna
this
take-
is one place to start. You have a comment over here?
You said you guys meet on Wednesday, right?
We did meet this past Wednesday. Yep.
Last Wednesday, okay. I believe that because this is so new, you could really, 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 really get this right by taking advantage of kids who are already in care in high school, who needs credit for graduation,
Mm-hmm.
and get them involved in building this.
Hmm.
Also, so they can get credit for high school.
Mm-hmm.
Also, I think you can find some value in getting children who's in care, college bound, to form committees for, they need to play a primary role in this.
Mhm.
If you really care about getting it right, that's where it needs to come from.
Yeah.
Not a lot of people who were raised not in child welfare.
Well, and I will say it's a small group. It's about 24 people. One of them is a former foster youth who is now active with the State Youth Advisory Board. One of them is a former foster youth who is now a caseworker.
And I'm referring to the ones who are going through it now, because even my husband went through foster care and it looks totally different.
Yeah.
And it constantly looks different. Just the technology has made it totally different.
Yeah.
So if there is if you're really serious about doing something different, I think if you can come up with creative ways to get high schoolers who's currently in child welfare,
Mm-hmm.
and the ones who have really good, who's good in school, who looks like they're going to be interested in participating, ask for that, but then also create pathways for them to get scholarships to pursue a career in social services,
Mm-hmm.
to continue what they started.
Okay.
So
I'll take that back.
I believe that if you guys are tired of just repeating the same, let's keep talking about, let's schedule another meeting to talk about it, schedule another meeting to talk about it, the missing piece is the end client, your end user, who it's affecting. And I know even if you're bringing a few people to the table who's had that experience, there's nothing like bringing the current youth, they still need the college
Mm-hmm.
credit anyway to graduate. To graduate, not college credit, the high school credit.
Sure.
For community service credit is what I think it's called.
Yeah.
It's required anyway.
Mhm.
So why not take advantage of that and really, because we're not going, as a foster parent, I'm going to give it to you from my perspective.
Mm-hmm.
And then I'm going to act totally surprised when it doesn't work for my kids. And that's what we do.
Yeah.
I'm going to spend all this time putting together the perfect plan, and then I'm shocked when it's not what they wanted,
Mm-hmm. Mm-hmm.
or it's not working. And all I had to do was go to the kid and find out what would have been better for you.
Yeah.
How could I have made this work for you? Because ultimately, if we don't have their buy-in, it doesn't matter how many suits are getting together to meet, or who went through foster care in the 80s or 90s or early 2000s. None of that matters when we're trying to apply it for the current generation or generations coming after them. Because all of that stuff is outdated now. I mean, even since COVID, things are outdated.
Right,
like people
right.
don't even want to go back into the workforce anymore. Everybody wants
yeah.
to work from home.
Yep.
So everything constantly changes. So you pull your newest ideas from the youth who's currently in the system.
Yeah. Well,
I
and
think her plan is awesome, but why do we keep forgetting about the kids that they don't work for? We always talking to the success story. What happened to those ones in residential treatment? I want to talk to that 17-year-old that thought everything was good at 14, but now at 16, something shifted, and you know, let me hear what his value statement is. What didn't work? That I mean, more of my interest, more so to see how I can change so that his brothers and sisters, or you know what I mean, stop that generational curse kind of thing going through, opposed to. I mean, I pray like Miss Veronica, like she's a success story. You know what I mean? Like we always hear. Not that I don't know how that looks to bring in that homeless guy that went through the thing, but I think
in a trauma-informed way,
yeah, to hear those stories, I think that would be more. We got to look at what didn't work.
Yeah,
because
no,
you already have access to them.
Mm-hmm.
I mean, you have full access to them. So why are we not using? You know, why are we not asking them what will work for them? Mm-hmm. Like it just doesn't make. It's just like minority groups. You know, when people who are, you know, let's just say white folks, who wants to make plans for what works great for the Somalian community.
Right, right.
You know, like, you know, and it just doesn't make sense to not include the people who you're trying to help.
Yeah, no, for sure. And that value, I think, is really important to keep in mind. We launched a program in Ohio called Youth-Centered Permanency Roundtables. If you're familiar with those, it basically puts the young person in the driver's seat for determining their permanency plans. So
I love it.
Yeah.
And that's the only way you can really get, you know, so those will be the people that you would ask, how do these value statements sound?
Yeah. Well, we want to ask everybody. Well, we will ask them, but we're testing it here today. Yes.
I have a question. So you said that you have youth that are successful, that are in college to become a caseworker, and you have other people that you have access to that are youth, right?
Mm-hmm.
So I heard you say you have roundtables and different things like that. So do you hold panels with some of the youth that you've worked with that have been successful, that may know some other youth that have not been successful, so that they can identify the challenges and the barriers? Because in my position, she's right. I have a success story, but the only reason why I have a success story is because I never gave up, you know. And when you have someone, like everybody in this room, predominantly African American, right? So you have different voices, but every African American voice or every Black voice is not the same, because we all grew up different, we came from a different cultural environment and different backgrounds, right? So you have middle class people, you have poor people, you have, you know, upper class, you know, rich, whatever. And then you have Caucasian people who, not all Caucasian people are rich. Not all Caucasian people are educated. Not all of them have access to resources. I mean, I literally kind of help equally. I see Caucasians that struggle and they relate to me and they take my success story and they say, well, tell me, how can I make my story have the same ending as yours, Veronica? So then I have to tell them, I have to look at where they come from. I have to get to know them first. If I can't build a relationship with them and get to know them, I don't know where they're coming from. So when we're transparent and we share different ideas and we say, oh, well, we need to hear from the ones that are broken, we need to hear from the ones that are struggling. The only way to get to the ones that are broken and struggling are to talk to the ones who overcame it. I'm not saying it's the only way, but I feel that by me being successful in what I went through, a lot more people who are broken are open to hear, well, how come what's the difference between me and you? Like, okay, well, you know, these are how my cards were dealt, how were yours?
And then a lot of times I get judged, like, oh, you're fake, or oh, you're this and you're that. And I'm like, no, not necessarily. You can't judge me off of, like, oh, well, she made it. No, we're different. We came from different backgrounds. We had different struggles. There's different things that bring these children into the, the microscope and into the limelight of children's services. And then it all goes back to what is children's services? What is their mission? Like, what exactly are we trying to do here? And then, like he has explained multiple times today, what is the systems? What are they really trying to do here? What are they trying to do for us? Are they really for us? Are they against us? Then there's a trust issue.
Absolutely,
So you have
and
to
that's why
actually
there's so much trust built into this.
So I feel that you would be better off having a panel and using who you know that's successful to go and find the ones that aren't and identify how can we fix this, because everybody has a different issue.
Yep, and you're the
It's gonna
expert
have
on
to
your
have
own
diversity.
experience.
Yeah.
Yeah, I will say we are not specifically focused on children in this. We are focused on families. How do we engage with families in a way that we currently don't, so that there's trust and honesty and support, so that those children don't have to come into foster care? Yeah.
From my experience and what I know, when you say caseworker,
Mm-hmm.
we get our viewpoint of a caseworker either from experience, or we get our viewpoint of a caseworker from somebody telling us about it or a movie. All three of those are bad.
Yeah, right.
If we see about a caseworker on a movie, oh, it's definitely not good. And if you talk to your neighbor who had to deal with a caseworker, not good.
Right.
And if a caseworker is at my door, not good. So when we hear the word caseworker, not good.
Yeah.
Word.
Yeah.
Change the mindset of it.
We've got a branding issue.
Have y'all implemented training that you have to do, like implicit bias being mandatory, or those the context blindness and stuff being mandatory trainings?
Yes. So caseworkers are required to get 102 hours of training
Specific,
up front. And
real specific.
yep, and
training.
there's some race and equity work built into that. There's hopefully going to be more with this next iteration of CORE, just around cultural competency, cultural humility, those sorts of issues. But then they have to get 36 hours of training a year in service training. But training's great, don't get me wrong. I work very closely with our Ohio Child Welfare Training Program. But then if you get all this good training and go back to an agency that doesn't embrace a learning culture, that doesn't embrace race and equity, or doesn't embrace create safety or have a good practice model, then all of that training isn't going to make much of a
But
difference,
who's
right?
the head though? Because the head normally trickle down to the rest of the body. So the head of that needs to be the one to
Absolutely, and
implement
that's why we instituted a lot of training with our agency leadership. Yep. Yes.
One thing I've always wondered, the kinship part of it, why hasn't the welfare department put more money invested into the kinship part so that the children can stay with a family member who knows everything, so that they never go into foster homes?
Mm-hmm.
If they funded the kinship, paid them what they pay us, because they're poor, they're different statuses too. I call it an equal playing field for them as for us. More children would go in with it's just like we take care of our elders. You always saw the bedroom, the bed in the living room. If the house they couldn't get upstairs, because we kept them with us.
Mm-hmm.
If we keep the children with their families, what's normal for me is not normal for you.
Yeah.
It's not normal for you. So keep them in their norm.
As much as I love and admire all of you as foster parents, it would be wonderful if we could put you out of work. It would be wonderful if we could shift to a kinship care system instead of a foster care system. And you're right, we don't pay the same. And there was a federal lawsuit just to that effect, right?
And really, when I just learned this today here in your class, foster parents didn't sign up to be a side job for somebody that should go to jail, or a side job for somebody with mental health. We were trying to be an aid to help this kid until the family get it right.
Exactly.
Now you're saying you throwing them into foster care, and we're the prison.
Yeah. Right.
Individual prison.
Yeah, that's not what you signed up
That's
for.
not what we signed for, so that's why when you call us and tell us this, he got this.
That's why you say no, right? Yeah. No, you're absolutely right.
So it's a whole system that needs to be revamped.
Yes, absolutely. That's what we're about is reform.
Collectively, that's what I formed from everything that has been said. The whole system needs to be revamped.
Yep. If we could build it from the ground up, it would be very different. We hope, right?
Families do need to. I mean, the children should stay with the family, and the family should get just what a foster care person would get. Bottom line.
Yes.
Would it be fair to say they would kind of pimp the system though, if y'all think to it? Like if the kinship family, you know what I mean? I'm gonna have my aunt keep my kid, even though I ain't even in a bad situation, but if auntie, if you go down here and get the baby, then you know what I mean, we get such and such and you just split it this way and you get Johnny's kid under your custody and this, that. I can see them pimp the system.
There's casualties in every war.
Wait a minute.
There's casualties in every war.
That's it.
Wait a minute. You're right. Here's my thought process and all that. Because see, I have a whole thing about that. You know, they talk about, people, pimping the system and this, that, and the other. The top head been pimping the system.
Yeah.
Corporate welfare, right?
Wait a minute, pimping the people and the system. I mean, good example. Let's just take this. We're at war, but we're not at war. There's a war going on right now that we're funding. United States is funding. Have no problem with that. But we will not fund to take care of our own people right here, our kids right here, our families right here. No one should be homeless. I mean, no one. We can have little box homes for people who can't afford homes. Come on now.
And there's a huge racial equity issue with kinship care
Huge.
because
And it's
more black children are more likely to be placed with kin, white children more likely to be placed with foster care. For whatever reason, black families are more likely to step up and offer to provide kinship care, and we don't want to pay them.
Right. Because we gonna
You said a whole mouthful right there.
Because we're gonna, 9 times out of 10, we're gonna take care of our own with whatever we can. We'll cut.
Because we're used to not having.
Listen, I'm a person who has a master's degree. I have a practice of my own, all of that good stuff. I was a teenage mother. Now I'm all broke down, my body all broke down and everything. And I'm caught between a rock and a hard place.
Mm-hmm.
Now, when I have surgeries, I have no income. None. Zip. If I did not own my own home outright, I would be homeless at certain points in time. Because you get no cash benefits. I've worked all my life.
Mm-hmm.
So there's a huge problem with that. Because the system thinks that there are some people who have abused it. Well, here's my thought process. If you got $2 and you found a way to get $4, I don't call that using the system. You can't become a millionaire off of $700 a month. I'm sorry. Hello. It's just, so it don't make sense don't care if there are two families who made 2 extra cents. So what? So let it go.
Do you know what research shows? That the number one thing to prevent child abuse and kids coming into foster care is concrete financial supports for families.
Yes.
When families have the money they need,
To take care of it.
They
they can take care of their kids. That is the number one prevention program proven by research. This country is probably not going to do it for a long, long time, but
The thing
that's-
is that, just like she said, the people who making decisions has her viewpoint. So we're not getting ready to pay kin folks where they gonna be able to make extra money.
Right.
We're not gonna, they have that
They
position.
have that.
But again, we still wanna act like we wanna do something about it and we for about it. So let's sprinkle down and let's invest in programs and systems and things that we know won't work.
For example, this is the funniest thing ever. The best thing about the pandemic when it hit, was when men had to figure out how to deal with childcare. Then, when it became a problem for men, they said, you know what, y'all can work from home. I think y'all can work from home. I think we can make this work. But when women have been complaining about childcare for centuries, it was always just figure it out, you know, it's your problem. But when they shut them schools down and it became everybody's problem, then it was like, you know what, did y'all know there was a child care issue?
surprise. Well,
I think we can work from home now.
and that is a great research project for somebody, because you know what a lot of people said during the pandemic is, oh, those children are trapped at home with those bad parents. Abuse is going up, and the teachers aren't seeing it to report it. Well, guess what? Most of the reports from teachers aren't screened in. They're not abuse. They might be educational neglect. The kids might need cleaner clothes or need to bathe more often, but it's not abuse that requires foster care intervention. There are actually some preliminary studies that show when the families were getting the rent supports, the food supports, the income replacement supports that they needed during the pandemic, they were thriving. And we weren't seeing the children coming into emergency rooms with terrible abusive injuries and the terrible fatalities that we were seeing.
But on the
So,
backdrop, we are going to see some in a couple of years, that obesity and all the diabetes, that's stuff going to be on the rise.
gaming addiction, Netflix addiction.
We have not seen.
Yeah, no, you're right.
We have not seen the whole direction set out a whole year. We haven't seen the response of a generation.
I'm guilty of that. Yep,
Set out a whole year and what kind of problems that's going to bring.
that's a good point. Good
We
point.
got kids that they hate people or don't like being around people. Because they prefer to be in the house.
So let me check time on us just to kind of see where we are. We are about 20 minutes from being done. Are you all interested in kind of continuing this discussion? I did bring a few more slides about Family First Prevention Services Act, but we don't need to talk about that if you don't want to.
You trying to encourage that?
But there's just really a huge divide, and I think we're in for a reckoning.
Mm-hmm.
I think
We've seen it start.
Yeah, because there are so many cultural divides and so many misunderstandings and misinterpretations. I brought myself back to the inner city because what I seen was you have big agencies. I've worked for quite a few who the people working for the agencies really want to help the family, but the agency itself is concerned about. And so you put so much of a workload, I think that's another thing that the pandemic panned out. You put this huge workload on these people, and they gotta see so many people, they gotta get all this paperwork done, and you expect them to do it in this amount of time.
At the, yeah,
And
at a
if
low
I'm-
compensation.
Right. If
Mhm.
I'm expected to see families for this amount of time, and then if you include travel time, when am I expected to do notes?
Yeah, no, you're absolutely right. That's
You know-
part of the workforce challenge that we're having.
Exactly. And so that's a huge problem. I'm not gonna work for free.
Right.
I'm not doing no notes for free. I'm not gonna sit. When I see families for free, I see them because I choose to.
Yeah.
Not because some agents.
But high school interns will. I'm just saying.
Put them to work, right?
You know, because high school, these kids are intelligent.
Oh, yeah.
These kids are smart.
Yep.
These kids, there's value if you can bring them on the team, like really make them be a part of this team and become a part of the solution. Because like she said, you know, there's a lot of things that you're not going to be able to get from us. But for them, they're starting out. This is what she is. They need this experience
Mm-hmm.
just to go off to college. They need this responsibility. Everyone needs responsibility. You take a child who may feel like they have no voice, being ignored, have no control over something, and give them a title and see what happens. I mean, you guys are around gold all the time. And I just hate to see you guys just leaving it on the table and not using these kids in care because they're brilliant. These kids are brilliant.
Yes, absolutely. We've had some of them on our legislative panels testifying at the State House. And
Yeah, they're awesome.
Yes.
yep, they are serving as on advisory councils that we have. There are some wonderful folks who, you know, you have to kind of be careful, right? Because we're also using parents who've been involved with the Children's Services system now as peer mentors, particularly for our Ohio Start program. And you have to be careful that you're not re-triggering, re-traumatizing them from what they went through. But if you do it in the right way,
Do it the right way.
yep,
That's right.
Because like you just showed on one of your slides, you have caseworkers who are going through PTSD. I mean, this industry is not, I mean, it's a rough industry.
yeah, yeah. Not for the weak-minded.
Yes.
And it's definitely not good if it's been going the wrong direction all these
Right.
years.
Mm-hmm.
And people got PTSD out behind it, and it's been going the wrong direction. And we still got 16,000 kids in foster care, and we trying to revamp a system that hasn't worked. They need some help tomorrow, today.
Can you imagine career pathing? Your high school students they want to go to college, but maybe don't know what field they want to go to, and
Yep.
offer them some tuition, you know, to take care of tuition if you graduate with a degree in this, social work.
Mm-hmm.
I mean.
That's one of the things we've talked about as a workforce solution. You know how several years ago they were predicting a nursing shortage. They did a bunch of public service announcements. They really tiered the certifications for nurses. We could do something like that for children's services and
What
start.
about going into the churches?
Mm-hmm.
Yes,
I
yeah,
mean, that
Many of our
right there.
agencies do that to recruit foster parents.
absolutely.
Yeah, I mean, the churches, they're always, you know, should be some kind of a place for people to go to, not just for, religion, but also service.
For service. Mhm. Yeah. And that's a good place to recruit some people who feel called to really work with those older, high needs youth with behavioral challenges too, so.
Especially the mega churches that could really be doing something besides.
Yeah, filling those huge buildings, right? Yep. All right. Final thoughts? I can tell folks are about ready to end the conference and head home. I won't belabor all of these other than to say that, Children's Services System trying to drink from a fire hose with all of these challenges coming at us.
That's hilarious.
But we are available. Check out our website for the workforce report, the placement crisis report, continuum of care report, if you're interested in more. And feel free to contact us. I'm Scott Britton. You can contact me at scott@pcsao.org. And thank you so much for coming. Thanks so much for coming. And we will send these slides out so that you don't have to.
Oh, thank you.
Yeah, you'll get them, I think, as a conference follow-up. Plus the recording will be available apparently. So hopefully they'll make me look good.
Awesome.
Yeah, but a signer paper?
I can. I didn't know I had that authority.